Hello again. This is Jenny with My Nurse at Home, just coming to you to bring some information about a lumpectomy and what to expect at home after your surgery. And just a little disclaimer before I get started that I provide support and education services for my clients. I do not take place of your medical doctor's information or advice. Okay. So just to be clear, lumpectomy is breast conserving surgery. It is also called partial mastectomy. And I will be turning to just check my notes to make sure I cover everything that I want to cover. Many times it is accompanied by a sentinel lymph node biopsy, which is a second incision under the armpit so that your doctors can check your lymph node status. They do this by injecting a blue dye into your breast around the nipple. Sometimes it's before you are put to sleep, so you will feel this fairly uncomfortable injection. Sometimes, if you're lucky, they do it when you are already asleep. If that is done to you, when you wake up, you will urinate the blue dye out. So don't be alarmed. I call it your Smurf reaction. So you will see blue and fading, obviously, to lighter blue, kind of greenish urine, and sometimes even stain your bowels, meaning your bowel movements, your poop will look a little bit bluish green for a day or two. Usually within 48 hours, this is completely resolved. So just, kind of take note. For a day or two after surgery, you're probably going to be a little tired, probably going to have some pain. Just take it easy on that. You usually can shower within 24 hours, 48 at the most. You do need to wear a well-fitted, supported bra for generally a week, day and night. The only time you want that off is when you're showering. In the shower, it's important to wash the incisions. Put the soap on your hands, wash over that area, and then just let the shower water rinse it off, pat dry. Don't rub on any of the areas, and that's until your steri strips or your incision or your sutures are removed. If you have any issues like oozing coming out, or if you have a fever, you do want to contact your doctor's office and follow up with them. It's important to rest after this procedure, but it's also important to not just be stagnant and stay still. You want to get up and try to walk each day. Start out just walking a little bit and then increasing a little bit more each day. Okay, we don't want to just sit around. You also don't want to lift anything. I say heavier than a gallon of milk. Some doctors will give you up to 10 pounds. Some patients just have a hard time gauging how heavy that is. So just be careful about overdoing it. Okay. You don't want to do that. Generally, driving is safe as long as you're not taking any medications, pain medications that are opioids or narcotics. And as long as you are not taking those any longer, you're okay to drive. Normal diet is fine. If your stomach's upset from your medication, just stick with the bland foods, crackers, rice, boiled chicken, things like that. Toast, but otherwise you're good. The other thing that's important about the walking is it will help with constipation, and it will also help to make sure that your bowel movements are staying regular, and it also helps your lungs. The lungs you have higher risk for having pneumonia after surgery. So we want to keep lung function going. So make sure that you're taking deep breaths as well. All right. So again, just follow your doctor's instructions for any restrictions and what medications they've given you. Follow those instructions carefully, and make sure that you're paying attention to keeping the area clean and dry. Pat dry is important. Don't rub anything on the area. And then just make sure you're following up when your doctor has advised you to. Your follow-up is key so that you can know what your next steps are as far as your treatment. Okay. Any questions, please let me know. I'm happy to work with you and your providers to continue supporting you in your journey. All right. www.mynurseathome 714-696-8773. And I'm Jenny, always happy to help. Take care.